Nicola Hill. She joins me now from London. Hi there, Nicola. This suggestion of putting off vaccinating children in countries that have had very good vaccination campaigns, a good idea or not?
It depends really, doesn't it? I mean, a lot of parents who are concerned about children being kept out of schools would certainly like to see them vaccinated. Lots of polls have said that. But there's two issues here, as you sort of referred to. First of all, the ethics. Why should we vaccinate children whom it's known have a very low risk of being severely affected by COVID-19 when you have got such a swathe of the world's population with no access to vaccines? And you also then have, is it right to vaccinate children? Because really we're vaccinating them to protect adults, because we know, particularly with the Delta variant, it's incredibly transmissible. And so children are, particularly young teenagers, seem to be spreading it very widely. That's why it's so spread across the world. That's why it's reckoned by, in about 4 weeks' time, it'll be the dominant strain in the whole of Europe, certainly. So if you vaccinated children or young teenagers, you then would prevent the spread of this very transmissible variant. But should they be vaccinated? There have been some trials. Pfizer did a trial showing that it was safe. You've got countries such as the US, Israel, France, whatever, who are vaccinating children. But also you have now had some results. I think it's with 6 million children in the US who've been vaccinated. There have been over 500 cases of myocarditis, which is a sort of heart condition. So you have got various experts, certainly Professor Callum Semple here in the UK, saying there isn't enough evidence yet to say that it is completely safe for us to use vaccines on all these children. And then you have got the situation in many of the poorer countries where fewer than 1% of the population has been vaccinated. As the Delta variant spreads, healthcare systems are going to be overwhelmed. They're going to run out of oxygen. You've got healthcare workers who are so stressed, burnt out, can't continue. So that's why a lot of scientists are saying it would be much better to give those excess vaccines not to children in the first world, but to give them to everybody across the globe and protect the world. And that's something that WHO is saying as well.
Yeah, and while some countries are now considering whether to vaccinate children, other countries are also looking at whether to provide booster shots to their populations. How necessary is the booster shot, especially for countries that have had the majority of their vaccines that have been Pfizer, for example, that has probably the highest efficacy rate against the virus?
Well, it's quite interesting. Professor Andrew Pollard, who actually leads the Oxford AstraZeneca team, is saying that there's a lot of question marks about the need of the boosters because they don't as yet know how long immunity lasts. So antibodies do wane, that's a fact, we do realise that, but he says that happens in lots and lots of vaccines, and our body's immune system is amazing. It recognises, it might dampen down a bit, but if you have come into contact with the virus again in various diseases, the body's immune system recognises and springs back into action. And so he says at the moment the need for boosters is not necessarily confirmed at the moment because they simply don't know. And certainly here in the UK, they're talking about giving boosters to, first of all, over the 75s this autumn, and maybe even to everybody over the age of 50, along with flu jabs this winter. But as Professor Pollard's saying, we don't know. You mentioned there different vaccines have got different efficacy rates when they had, certainly with the first jabs, those like 96% with Pfizer and sort of 60-odd% with the Oxford AstraZeneca. That's becoming evening out with these double jabs. It's looking like they're all protective. They're particularly protecting against the variants we know about. We also know that, for example, in Oxford and various other vaccine manufacturers are looking at developing tweaks to the vaccines to be effective against the beta variant, the Indian variant. So if we've got those vaccines, again, the same ethics apply. Why give a third dose, booster doses for most vaccines to people who are double jabbed, who are protected, when you have got so many people across the globe who haven't had access to even one. Professor Parg was quoting the fact that 55,000 people died of COVID in the last week, and most of those are in areas where you just haven't got any vaccines. So again, the argument is, can you ethically give boosters dose number 3 to people who are double jabbed and protected when so many people haven't even had that first dose?
Yeah, it seems to be so many questions still surrounding vaccination of children and these booster shots. Nicola Hill, thank you so much.